Hi, I'm Shelley. I'm one of Dr. Cole's patient coordinators, and today we're going to be talking about facelifts, the different kinds, and what you need to look for when you're researching. Dr. Cole, what are the different kinds of facelifts, and who is the right candidate?
If we're looking at who's the best candidate, it typically strikes into age groups and how much volume loss you've got in your face. So we look at kind of two different criteria when we're doing facelifts. One, do they have a lot of lower facial volume? And in those cases, we may need to do something called a deep plane lift. In other areas where we don't have a lot of lower facial volume, and then we want to do something called a mini lift or a mini neck lift, and now to combine those two.
Who would be a candidate for a deep plane facelift?
So if we're trying to get a deeper, more natural, accurate lift, a deep plane lift is really for those that have in the target zone, say 50, 60, and 70-year-olds that have a lot of buccal fat going down, a lot of buccal sagging, a lot of jowl sagging, and a lot of neck sagging. So the deep plane lift is really the gold standard for lifting up heavier jaw lines and heavier neck lines. They do take a little more time to heal, a couple more days than a mini lift, but the results are just so much more spectacular than, say, a mini lift. It's just a mini lift in an office simply can't hold up or pick up that whole area.
What is a mini facelift?
In a mini lift, you undermine the skin in a limited amount. You do roll the mass up just a little bit, but the mini lifts are not going to pick up a heavy jowl. They're not going to pick up a neck real well. And there's something great to do in the office in really a target zone of about, say, late 40s, early 50s. Those pick up great with a mini lift. You can do ancillary procedures with a mini lift and add some fat in those areas, but there's no real comparison, say, with a deep plane lift.
Do all facelifts include fat grafting?
Pretty much. That's an ancillary procedure that makes the volume where you've lost your volume. If you look at a skull, that skull typically starts to age at about age 40, and you'll notice that the skull gradually starts to lose nearly 5 cc's of volume starting at age 40 per year. So top that with your ligaments relaxing and letting go, and you realize kind of why the face starts to fall down. So we add volume in areas where the bone is gone. That's your zygomatic arch right here, and then of course right under the cheek. And if you want to add that volume back, you can use fat out of the lower eyelid. You can even use buccal fat pad and put up there, but the finest with the most stem cells are from the belly button area, and you add the fat all through here to recreate the appearance of that volume, that youthful volume and natural volume in that mid-face onto the zygoma.
Is it appropriate to have a deep plane facelift in a clinic, or should one go to a hospital?
The deep plane lifts do take a little more time. So typically in those cases, it's in an age group that you really want to do in a hospital setting, simply because if you do it in a hospital setting, you've got a lot of anesthesiologists and a lot of people watching over you to make sure that you're healthy and get through it. And we don't really want any weird things to happen, and that's why we do them in a hospital setting. In office setting, mini lifts are very safe. They're easy to do, but the deeper lifts, you really want to be able to do those in a hospital setting.
What is the recovery time for a facelift, and is it different between a mini lift and a deep plane lift?
If you're doing a deep plane, typically you're going to expect about 10 days. So usually we do those on, say, Tuesdays or Wednesdays, and so those will come back about 6 days later to get the stitches out. The staples come out at about 9 days. You can wash your hair that day also. So at that point, you've got hair washed, you've still got swelling. Swelling's still there on a deep plane. Again, they take a little bit longer than a mini lift, but typically at about 10 days, you're able to put makeup back on and go back and do what you want to. We don't want you moving around too much for about 2 weeks, but typically those are getting back close to normal after about 2 weeks. Mini facelifts, they heal quicker. So you're going to have a mini facelift, and that takes about 5 or 6 days for things to start to settle. Again, most of your swelling is still going to be 2 weeks, but it looks a lot more natural, and it's accentuated because we've usually done fat graft at the same time, so it looks good.
What about scarring? Will I have a lot of scars? Can I wear my hair up?
Facelift scars are usually hidden. So you do facelift scars right at the hairline. For a vertical lift or a deep plane lift, you really want to be able to hide those right up by the hairline, behind the tragus, that little tiny little thing that sticks out behind the ear, and then of course right behind the hair, so that those scars hide when you wear your hair up or down, so you don't have any scars that are visible from any angle.
What exactly is a buccal fat pad?
Well, a buccal fat pad is a deep fat pad, one of the many fat pads of the face, but it's a really big one that starts about here and goes all the way under the bone of the face, and it goes on to that pre-jowl. As you age, it doesn't stay there. So it's gradually going down along that jawline and ending up right here to push forward and fall down. And if we look at what those fat pads do, basically they're pushing the face down onto the neck, and then the neck redeposits skin and all the fat right up under the neck. So now you've got this big area that's kind of rolled over, and if you don't address that with a facelift, it's going to mess up even a mini lift. So the buccal fat pad, typically, if you're say 40 or 50ish, you can go in from the inside of the mouth and pull those buccal fat pads out. If you're over that, it's fallen down into an area that's got a lot of nerves, and we don't really want to go digging so hard to find that because there's a lot of nerves around it. So typically that fat pad's removed as we do the facelift. Go forward, spread the nerves apart, pop in there, pull that fat pad out, and then this whole masseter and buccal ligament can be pulled up, and you've got this real nice tight little right side up heart of the face again.
What if you leave a buccal fat pad in place?
Well, if you didn't address the jawline and get the buccal fat pad out, you can actually accentuate the fat pad as you pull back, and this thing sticks out the whole time, which looks much worse. So you've got a lot of people trying to do mini lifts in the office, and they don't address the fat pad, at which point it looks worse and it's still pushing down on the neck, and you don't have a happy patient with that.